Without a doubt, the year 2020 will be unforgettable for many reasons. However, despite its many challenges, Hospital Adventista Valle de Ángeles has continued to move forward. The pandemic has forced us to create new patient care areas, including triage and treatment spaces for COVID-19 patients, in order to maintain biosecurity for the rest of the hospital. In addition, we separated an area in one of the existing inpatient wings to accommodate acute care patients separately from our long-term care patients. We also have a project in progress to remodel the emergency department and install a CT scanner in Valle de Ángeles. In Tegucigalpa, the purchase of additional property next to the clinic allowed for the creation of new medical imaging area, a minor procedure room, and approximately a new endoscopy suite. This will allow for the expansion of services in the capital city. Our work could not have advanced so rapidly if it were not for the generous donations of various institutions. We are very grateful to Adventist Health in Oregon for the donation of an ambulance in excellent condition. We also give heartfelt appreciation to Advent Health in Florida for the donation of a large amount of biosecurity material as well as a TC scanner that will benefit more than 25,000 people in the area that did not previously have access to these services in their town. Finally, we would like to thank Adventist Health International for their financial support in the creation of new triage and patient care areas necessary to face the current pandemic. In the area of social responsibility, we were able to open the first center of influence in the hospital, offering different courses such as reading and computer skills aimed at promoting personal development and improving the quality of life for people in our community. From this effort, we have obtained several Bible study interests. The current global crisis has hit Honduran society hard. In order to mitigate the impact, we have carried out different activities to support our community. Earlier this year, there was a bad drought in our town that left many people without access to drinking water. With support of the local conference, we repaired a tanker truck and used it to take water from our hospital well to the areas most affected. In addition, due to the drought, there were many forest fires in the forests surrounding Valle de Ángeles. In response to this devastation, we gathered 50 volunteers to clean up and reforest the most burned areas, planting more than 2,000 trees. The COVID-19 pandemic has also greatly impacted the economy and sources of employment in the country. Because of this, many families have been unable to provide even for their own basic necessities. The hospital has supported them with a food collection campaign, resulting in the preparation of more than 1,400 lunches, 250 toys, and 100 solidarity boxes that were delivered to the neediest people in the community. Arising from the needs detected in the social work carried out by the hospital, the initiative was taken to fund a Pathfinder Club in one of the poorest and most gang-infested neighborhoods next to the hospital. Due to this Pathfinder Club alone, 21 people have been baptized. This work has created the need to plant an Adventist church in the neighborhood, which will be built by the hospital in conjunction with other local Adventist churches. We have faith that this initiative will impact the entire community and will open opportunities for many others to know the reason for our mission. We firmly believe that in humanity's needs is God's opportunity, and that in these days of crisis, we must present the gospel using Christ's method, meeting real needs and expressing compassion for our neighbors. We continue to give our best so that others can know God's love through our actions. We desire to be a little light shining in the midst of the world's affliction until the day that Christ returns. The medicines may be the same, but the hands are different. Hospital Adventista Valle de Ángeles, total health and wellness.